our healthcare standards are, to adjust those standards to the reality of what you've learned. So I worked uh, in the clinic there in Sapit for a few months, and I felt like I was really necessary because of the cholera epidemic. So much of the personnel was really busy dealing with that. So I was a busy bee doing primary care, working with a translator. I didn't know any Creole, so I really absorbed a lot. But the next year, when I came back enthusiastically, the cholera luckily had been controlled, and I really was no longer needed in the clinic in the same way that I was prior to that. So not really knowing what to do, a couple of community health workers that I knew said, well, why don't you go up into the hills with us? These people have no health care whatsoever. And I had brought a big bag of medication, and they said, well, let's just do a few uh, clinics up there, kind of shake and bake clinics. So when I got there, the local leaders, who are these fellows that, except for the white guys on the right, who were the local leaders of this town, Majofre, had put together enough resource to build the clinic this far. They had no healthcare services within hours of travel. And so it was their dream to create something that could serve their community. So with money that they pulled together along with their friends, neighbors, and relatives that are part of the diaspora, including bus drivers from Brooklyn and house cleaners from Atlanta, they got this far. And this is 2013. And the fellows on the right are two guys that helped me found Hispañola Health Partners. And so out of that visit and a couple of encounters early on with the local leaders, we created Hispañola Health Partners, which is our mission is to strengthen healthcare systems along the border of Haiti and the Dominican Republic. And it helped us establish our sister clinic, Centre de Santé Union de Grangossier, which is a long tongue twister, and I'm going to call it CSUG. This is our sister clinic. And now it's been up and running since 2016. We have 24/7 care, lab, emergency, pharmacy, lots of different services with maternal child health, cervical cancer, another female cancer screening, et cetera, et cetera. So it's our pride and joy. I'm going to introduce you to the Haitian woman, and she is really the keystone, the center of Haitian culture, Haitian community, Haitian family. And she's often called the Potomitan of Haiti, and that is the central pillar of the peristyle of the, which is the Voodoo church in Haiti. And so without her, the structure would collapse. And this is a great compliment to the Haitian woman, but it also keeps her somewhat cemented and hobbled with this expectation of responsibility and dependence. So there are many women in rural Haiti that kind of find a workaround for this, because despite the fact that 51% of them have had no education, 37% have just finished primary school, they begin work early on as Madame Sarah, which are women in the informal economy. And they haul their goods every day to markets, sell their stuff. They are shrewd and clever, and you don't want to get in between them and a good bargain. And here we have this woman with matching chickens in her basin on her head that kind of go with the hibiscus bush in the background. They haul amazing amounts of goods on their heads up impossible steep mountains. Their bodies are beautifully muscular, and they can just they they impress the heck out of me. And they also have backbreaking work. A lot of their day-to-day happens in this position where the kitchens are basically on the ground outside of the house. They have to watch their children don't get burned in the fires while they're cooking food, hauling water, etc. So the kind of cleverness that they use in their humble trade is kind of shown in this slide where she's selling a soup of plantain and beef, and this is her form of advertising. They also are devoted to their religion. They sing and they dance, and that kind of uh, feeling is in the air all the time. I can't tell you how many nights I wake up in the middle of the night and I can hear drums and I can hear singing, I can hear chanting, and even parading down the streets at 3 o'clock in the morning to go to some ceremony, be it Christian or voodoo. It is just the pulse of their life. And some are extremely elegant in whatever sort of small resources they have. They have this kind of flair that brings out the beautiful styles and colors that are all around Haiti. And some of them are, everyone is extremely humble, like this woman who is a neighbor of ours. The life expectancy now for women in Haiti is 67, and that's up from 57 about back in 1990. So out of sort of the harshness of the environment, they again embellish with their dress and color, and like this little pumpkin here that came to our clinic a few years ago. They were also fiercely family oriented and would sacrifice amazing amounts of travel and money and resource for their children. This is a group of women waiting for their babies to get immunized at our clinic. There is some organizing women's groups all around Haiti, which have been a bit hogtied right now by the political situation that's been really rugged for the last 2 years, but they are they're a good organized force that help fight for women's rights and against domestic violence, and in a community, in a culture that's extremely patriarchal. So I'm going to give you a little snapshot of the area of Haiti where we work. It's called the Arrondissement de Balance, and it's a 300 square mile corner there. It's full of mountains. The word Haiti is a Taino word meaning mountainous, and indeed it is. And high in the mountains, above 1,000 feet, it's cool and it rains more often there than anywhere else in the country. And you can grow cauliflower and broccoli and cabbage and all sorts of things. And it rains there enough so that the torrents of rain come down and make these beautiful waterfalls that we've enjoyed swimming in. It also has 50 miles of completely untainted coast that is home to many fishermen who make their own boats, make their own sails, make their own nets. It's really kind of a time travel back into another century. The land is pretty harsh. It's pretty stark, has a lot of volcanic rock, cactus, dust. And it's amazing that the subsistence farmers can make a living. But everywhere you turn, there's beautiful things like this flamboyant tree, and just kind of out of the starkness of the stony earth, you see something just remarkable like this. Also dotted all along the countryside is the beauty of the children, loving the way they all wear the same color at each school, um, whether it's pink or orange or blue or violet. You see it everywhere in Haiti. Um, so while I was working with HHP trying to get the money together for the clinic, I kind of reflected on those ideas of, observing, understanding, and adjusting, and realized that there were no preventive services for women, as Beth had said, beyond maternal child health, um, particularly for cancer screening for cervical cancer. And indeed, in Haiti, they say that the cervical cancer is the highest in the world. That's not really because women are more susceptible to cervical cancer there. It's really because there are no services, and the cervical cancer rate would be as high in the US if there was the kind of negligence that occurs in Haiti. So I had heard about this technique called visual inspection with acetic acid um, uh, years ago, and I studied up on it and kind of brushed up on it. It is a World Health Organization uh, alternative to the pap smear, which in many countries, Haiti included, is really not logistically possible. So we started a campaign in 2013, uh, I and some Haitian nurses going around to homes, and this is a discotheque, and even into cardboard shacks that were on the border of Haiti and the DR, when the DR deported Haitians that were undocumented, and there was a huge camp there of thousands of people. And just using the simple technique of vinegar, which causes an aceto-white change on the cervix, which indicates possible dysplasia or possible precancerous changes. Um, you can you can detect this and then treat it with cryotherapy, which is with um, as- with CO2 and a cryo gun, and everything could fit on the back of a motorcycle. And indeed, that's how we got around. So for 3 or 4 years and 3,000 women later, this is how we did it. All you need is a simple headlamp. You don't need electricity. For instance, in this hospital, every once in a while, we would be able to do our screenings in a hospital or in a clinic, but this one had no running water or electricity at the time. So we have workarounds with that, with a headlamp and buckets where we haul water to do the decontamination of the speculum and other equipment that we're using. So this is a little shot of what the road looks like. And thanks to a grant from WIL, I started in 2014 to train uh, healthcare workers in the Arrondissement de Belens on the technique of VIA. And we did 3 different teachings, 3 different trainings in the next year or so. And we were able to teach a cadre of 20 healthcare workers, nurses, doctors, and community health workers on the technique. And I was also able to donate cryo units and CO2 tanks to the 4 main clinics of the Ministry of Health in the arrondissement. Then we fast forward a little bit to 2018. It had become kind of agreed through WHO and other organizations like Johns Hopkins that HPV testing, self-testing for high-risk HPV, the causative virus for cervical cancer, would be best done by the HPV self-test. And we started a program called Aider Tête Nue, which is helping ourselves. in order to screen for cervical cancer in this way. And we also added a component of breast cancer screening to this. So just by using a simple swab, the woman can swab herself in the privacy of a her own home and deliver this swab to a community health worker. And so that's what we have done 1,800 tests around the arrondissement. We no longer needed the heavy CO2 tank bogging down the back of the motorcycle. We were able to switch to something called a thermocoagulator, which does ablation of the precancerous cells with heat. And it's very simple, and you can carry it in something the size of a lunchbox. Um, Here's our supervising nurse teaching a group of community health workers how to do the, uh, the HPV swab. And we had a cadre of 18 community health workers that worked on this project. And the community health workers, as many of you know, are just the heart and soul of low resource setting impact on community health. And having a program like this that paid the community health workers, that educated them, that gave them kind of voice to their community and empowered them, makes them so much stronger as new initiatives come down the line that are needing their service. For instance, in during the COVID uh, early COVID months, that same cadre worked home to home to teach about hand washing and mask wearing and social distancing. Luckily, COVID has not really been a big scourge in Haiti. We'll wait and see. But much to the surprise and the delight of all of us, it seems to have not had such a huge impact. Also, this project contributes to policymaking around the world, because really there have been not very many projects in HPV self-testing in low resource settings. So our work with the women and the data that we collect are going to be useful in the future for policymaking. We also had this breast cancer component where women are taught self-breast exam. And then for positive findings, if they find anything abnormal, they come in for a clinical breast exam. And then if warranted, they get a sonogram. Mammography is really not available in Haiti. In some, at very few private clinics have it in Port-au-Prince or in Cap-Haïtien, but really it is not a reliable resource. I'm happy to say that our data is being processed and written up with the help of our team in Haiti by a woman from Philadelphia. This is Rebecca Henderson. She's from Cheltenham, and she's an MD PhD candidate that works in Haiti, and she's studying the development of oncology care there. And she, with Partners in Health, who is providing an IRB for our work, is going to be examining HPV prevalence according to demographic factors, as well as geography, and particularly the closeness to the border, because we found the positivity using VIA through all those years that we did it on motorcycle was about 7%, but once we moved to the more precise high-risk HPV test, our numbers moved up to an average of 23% positivity. On the border, it was as high as 37% positivity. Looking to the future, we have an ambitious plan to, as we have been teaching around the arrondissement about cervical cancer screening and treatment. We want to extend this training to Haitian professionals all around Haiti. And so we have a new project, Ensemble pour Santé, and that is to join together with other NGOs and also public health organizations, including the Ministry of Health, to teach um, the VIA, the visual inspection with acetic acid, and also incorporate high-risk HPV testing and kind of follow the model that we've been doing in the Arrondissement de Balance. In the meantime, while we wait for that to happen, Miss Muzak, that's the nurse there on the right in the green, continues to go around the arrondissement using VIA. It's a much cheaper method of screening. It only costs about $1 per test, where HPV is screening is more like $10. So she continues, the work marches on. So I'm going to change the speed a little bit and talk about maternal child health and a project that was sort of born and raised through our Haitian staff called By la Vie J'arrête, Give Life a Helping Hand. And the idea of this project is to incorporate traditional birth attendants with whom 90% of our women uh, give birth, and 90% of our women give birth at home. And these birth attendants are cherished and loved throughout the community. You can see they're kind of elderly and about half and half, male and female. Many of them began very early on, maybe even as early as 10 or 12 years old, accompanying a mentor, whether it be their mom or dad or uncle or neighbor, in in home birthing. And they incorporate, along with their compassion, a kind of a magic and a kind of folk medicine, as well as their skills as kind of wise people. But most of them are either low literacy or really have no literacy at all. Their skills were honed over the years. And there's By la Vie J'arrête is really a program to share the knowledge that we have with the traditional birth attendants to help decrease any adverse outcomes during the whole perinatal time. This course is, we take 6 matouans, that's the Haitian word for the birth attendant. They come to our clinic. They are trained by our nurse midwife, who's right there. That's Miss Lafleur in the pink shirt, and they come once a week. They're paid a small amount to come to learn, to improve their skills, and it's a 5-month course, which at the end of the project will be 18 skilled birth attendant, pardon me, a matouan will be improving their skills. Here's a matouan with his clean birth kits ready to roll. Also, Ruth goes around into the community, into the farther reaches of our district to do prenatal exams and work with a matouan after birth. She does postpartum checks and make sure that the babies are okay and that the moms are doing all right with breastfeeding, and also addresses some things that are kind of taboo in the Haitian community, like postpartum depression and domestic violence. We are breaking ground and actually have made some progress in building a birth center behind our clinic. And that will be a homey environment for women to have as an alternative to home birthing, where there will be a skilled birth attendant, but the matouan can join the woman there while she gives birth, but has the backup of some of the simple equipment and know-how that we have. Our last program that I'm going to talk about addresses hypertension in the community. which is a big problem there. About half of the adults over 50 have hypertension, and a lot of them are women, and more than 50% of the people with hypertension, and this is exquisite hypertension. I've never seen numbers like this. Anybody that knows about blood pressure, it's not unusual to see 240 over 180 as a blood pressure. And unfortunately, stroke and heart attack can really uh, disable a woman in the prime of her life. Also, women of childbearing age are about twice as more likely to have high blood pressure than her male counterpart. So that kind of screening perinatally is really important. So here we're doing some home visits in WIL, which is the name of the hypertension program. Again, something that was written and conceived of, and then kind of funded together. Um, it really reaches out into the community, uses a large group of community health workers to screen the women, screen the hypertensives and um, bring the medicines to the people and explain how to use them and make sure that they're using them correctly. So I just want to introduce some of the women that work with us. I think they really present themselves as leaders and models in the community and inspire other young girls to maybe move beyond their kind of already written destiny. And this is Alexandrine Marti. She is our administrator, our chief administrator. This is Marez Muzek. She's the supervising nurse for the female cancer program. I've been really lucky to work with her for the last 5 years. She's brave and gentle and uh, very intuitive, and she has learned how to use the computer since I've gotten to know her, in an Excel spreadsheet and things that she had never known before, but she's taught me a lot as well. And then there's Ruth Lafleur, and I'm just speaking about a few of them. We have 8 people that work at the clinic, and I'm sorry, we have 11 that work at the clinic, and 8 of them are women. And they, as I mentioned, all kind of provide models for future professions for women that, come from uh, really extreme poverty. This is the graduation of a class of nurses just this last summer, and our um, medical director, I don't know if you can see my arrow, but Danielle Antoine started this nursing school, and every couple of years he cranks out some future nurses, and they also do their clinical training at our clinic. So I'm going to bring things to a close and just kind of emphasize a few key points. And that is, of course, that women are the keystone to the Haitian culture and community, and the security of life there. And that as healthcare workers, we strive to really address the main health challenges of women in rural Haiti. And in the programs that we create, we really try to have it a bottom-up structure, something that is durable and designed for the long haul and doesn't cost any more money than um, is feasible. So, and my role in Haiti, and or as an international health worker, has really kind of morphed from a searcher trying to find where I fit in, to a clinician to kind of get on the motorcycle and do the stuff, to now I'm really more of an administrator and a mentor, and helping the folks at CSUG, at our sister clinic, to move ahead independently and to really sharpen their skills in things like building capacity and learning how to promote themselves, learning how to fundraise, and how to write grants. And I'm feeling like we're really making some big steps that are indicating some success in the future. And I want to end on a hopeful note in saying that really this kind of approach is not unique to Southeast Haiti, this ground up approach and integrating community health workers and the community and using local professionals rather than people from the outside. And this kind of paradigm is changing the way that we take care of one another from Mozambique to Minneapolis, and embellishing the resources that exist, and really focusing on the local can really make the health of communities and families and uh, our women all around the world really thrive. So with that, I'd love to open up to any questions that anybody may have.
So I'm happy to facilitate the questions, and anybody, I'm going to start with some of the questions that are currently in the chat. But after that, if anybody else has questions, you can either put them in the chat or just jump right in and ask. So one of the questions we have is, what is the main funding source for the clinics? Does the government provide any support?
Yes. So we do partner with MSPP, which is the Ministry of Health in Haiti. They provide all the family planning. They provide training for our personnel about, everything from medical records to HIV treatment. They do provide some testing, HIV testing, malaria testing. They are kind of driven by NGOs that donate for specific projects to the Ministry of Health, and then they can reach out to us to provide some services, but it is hardly adequate. MSPP has done nothing to promote female cancer detection and treatment. The clinic itself generates about 25% of its expenses. That comes from pharmacy and lab services, as well as a nominal fee for consults. And then the rest is HHP. We're working hard to get our, as I had mentioned, to get our staff really well versed in other resources because we are kind of I'm planning my own kind of irrelevance in the next 5 to 10 years. And we will probably always be paying a certain amount of salaries. That's what we spend most of our money on, is paying the $50,000 or so a year that it costs to keep 11 people employed.
Understanding your desire to provide support and deliver your mission, how did you choose Haiti?
Oh, I didn't really. I think it chose me. I just floated that way. I was working in the Dominican Republic. I did a fair amount of work with different groups of different NGOs there. I was always interested in the Haitian people, but because I spoke Spanish and I didn't speak Creole, I didn't really think about that until I I'm honestly, I was kind of intrigued by going to Onsapit, the border town, because I wanted to go see that part of the DR. And it was on the coast. It was kind of for selfish reasons. It seemed like a cool place to be. And then it just sort of sucked me in. It wasn't premeditated.
Are you able to work at prevention of hypertension and cancer?
I'm sorry, am I able to work?
Yes, at the prevention of hypertension and cancer.
Oh, well, yes. Okay, if you want to talk about those things individually, the prevention of cervical cancer, the best way to prevent getting cervical cancer is to not have sex, basically, because it's a sexually transmitted disease. So in our, that's totally illogical. So in our education of women, we and not just women, but young young people as well. We try to encourage safe sex and it discouraged multiple partners, those kind of things. And when I say we, it's not me, it's our Haitian team. Um, to prevent hypertension is pretty tricky because we do talk a bit about not using salt so much and sazon, this other stuff, that is like a seasoner that has a lot of sodium in it. But the jury's still out as far as if you read the literature, how important sodium is to what an influencer it is to hypertension. I think in a lot of ways it's genetic. I think people don't have access to water, so they're chronically dehydrated, so their kidneys are constantly being challenged. It's pretty hard. It's not because they're eating McDonald's or, it's really not the kind of health and lifestyle problems that I deal with every day at my clinic here. So the prevention of it is, it's tricky. It's not simple, and that's why they need medication.
Are you able to provide HPV vaccination, or is the cost and infrastructure too difficult to maneuver?
Yeah, thanks for asking that because I wanted to bring that up, and for the sake of time, I just didn't have it. But HPV vaccine is not available in Haiti, unfortunately, in a few pockets, and there are Partners in Health has found a bit of vaccine to be able to distribute in in the Central Plateau, there where their hospital is. But until there is a national campaign for HPV, and as soon as the Ministry of Health is able to get their hands on that, it will happen. I meant to say the Ministry of Health also does all the vaccinations that we do in our clinic, and I I feel like taking that responsibility away from them as far as the HPV vaccine would be detrimental. So until the country gets it together and makes that vaccine available all around the country, I wouldn't really want to be just a small pocket um, protecting our girls. I mean, I'd like to, but it's sort of on the big scale, it doesn't really make sense nationally. So until then, we're waiting. It also doesn't eliminate all of the women that never got the vaccine and would not qualify for the vaccine. So the march goes on.
Are there any plans to expand the clinics to other parts of Haiti?
Ooh, not in my lifetime. I guess we'll see. We do have some an abandoned clinic that's about 8 miles from us. That was somebody's big idea at one point, but the place is sorely neglected. The town of Grand Gossier, which is right on the coast, again 8 miles from our clinic, has nothing there. It is just a shell and of good intention. And we would love to bring our staff down there on a regular basis and kind of expand to that area at some point in time. And I know that that's a desire of our Haitian partners to expand in that way. But no, I mean, I really think small, and if we can improve the life in and the health of the people of the arrondissement de Balance, I feel like that's a good enough accomplishment.
Have you found that self-testing has reduced the number of women that require cryotherapy? And how do you get them back to the clinic if they have a positive test to treat them?
Yeah, we've had great follow-up luck, and women are actually, when they do the HPV test, we have many more positive uh, um, results than, and I mean positive is sort of a negative. I mean, as far as that, we have a lot more women with cervical pre-cancerous lesions detected with the HPV test. So, and it's funny that it's a much more specific test, and it's much more efficient, but it does have that caveat that you have to have follow-up, which is not so with VIA and cryo, or VIA and thermocoagulation, because it's called see and treat, which means you can see the person and treat them the same time. And that's wonderful. However, you depend on the acumen of the examiner, and if you don't really know and recognize the aceto white changes with vinegar, then you can miss a cancer. Whereas with HPV self-test, you don't miss the cancer. It is, it's guaranteed that it's going to get picked up. But we have had great ability to find the women, to bring them back. Now, we often go to them, and I would give the credit to the cadre of community health workers and also our nurse, Miss Muzak. She knows every single one of those 1,800 people. She knows where they live. She knows who their kids are. She knows who went to the Dominican Republic and hasn't come back. She knows who went to Port-au-Prince and hasn't come back. She knows who's pregnant and can't be treated then until they give birth, da, da, da. So we, because it's a tight knit community, and using this kind of outreach makes follow-up so much easier than, say, if you were doing it in the city of Port-au-Prince.
How receptive are the younger women to pursuing a healthcare livelihood, or is there resistance based on other needs of the family?
I don't really know, but I think many young men and women aspire to jobs in the in healthcare, as either community health workers or as nurses. I'm not quite sure what our doctor charges for nurses training, but I think it's probably pretty reasonable. And I would think most young women would love to have a job like that, rather than hauling 75 pounds of cabbages on their head up an incline of 90 degrees. So yeah, I think it offers a good alternative, and it must seem many men are interested in it as well.
That's all the questions we have in the chat. Is there anybody else who has a question or wants to speak up? Just unmute yourself and ask your question.
Maybe I answered everybody's question.
Louise,
I have a question. Okay. Go.
Oh, no, please go ahead. I'm a guest. You're a member.
No, it's fine. Go. They hear me enough.
Hi, my name is Kay Sandberg, and thank you, Louise, for a wonderful presentation. Thank you to Will for the vision of having this, and also for funding such amazing work. And I'm the convener of a network, of which HHP is one member of, and one of 4 partners in Haiti. And I just noticed that another partner from Southwestern Haiti, Jim Grant, and their board chair, Betsy Wickstrom, are on the call as well. So I just wondered, Louise, if you might say something about, the network, your leadership in cervical cancer screening and prevention, and the network that is around the country hoping to be funded.
Yeah, it's so great to have a global fund for health with us, and to have Jim, and nice to see you, Kay, and Betsy. No, I'm not sure.
And Aaron.
Oh, and Aaron's here too, because you can feel pretty alone in this endeavor, and like just that your challenges are yours alone, and nobody else has ever really had the same hair tearing problems. It's great to get together with other members of Global Fund for Healing, Global Force for Healing, that Kay helps run, and to put our heads together and see how we can solve some of these problems, how we can help one another with resources, and connections, trainings, and so forth. And for being in a far-flung little corner of southeastern Haiti, where it seems like it gets very little love from the outside world, this has made a really big difference in kind of the boldness that we have had to go ahead with projects. Ensemble Santé, for instance, the training that's going to involve all of the different districts of Haiti in learning the technique of VIA and HPV testing is a really exciting prospect that I'm looking forward to.
And this
Jim.
is Erin, and thanks for the great presentation. Did somebody else have a question?
Jim had his hand up, but go ahead.
Oh,
Erin's one of my soul sisters here in the HHP. She's a board member and has done a lot of cervical cancer screening with me. We met in Nicaragua, and behind a big pile of speculums, I think.
no doubt. I just wanted to mention with regards to the positive HPV rates and the how really that does require us to treat more women with thermocoagulation or cryotherapy than VIA did. And I don't think it's necessarily so much that VIA is missing things, because you can have positive HPVs without any visible cervical change. The positive HPV is it's a very sensitive test that can pick up someone. It just tells us that she's at risk for cervical cancer or she's at risk for cervical changes. It doesn't mean that she has precancer or dysplasia. So a positive HPV test, the current protocol is to treat all of those positive HPV tests with thermocoagulation or ablative therapy, regardless of findings on the cervix. So
Right, we went around about that because it was
Yeah.
kind of shocking to have so many positive HPVs. Luckily, we had a oncologist from Haitian NGO to kind of help guide us in our procedure. But it's true.
and I don't think it's even that high for for my practice. I think that is quite common, to have that level.
Betsy, were you trying to say something?
I was. I don't know. Can you hear me?
Yes.
Okay, good. Because that's my issue.
No, can't hear you now.
Let's try it now. Can you hear me now?
Yeah.
Okay. I don't know what it was doing before it started freaking out. What has always made sense to me as a clinician is you want to cast the widest net and make sure you don't miss any cancer. But you don't want to overtreat, because I've seen what happens to that cervix if you cryotherapy and you suck that transition zone way up into the cervical canal, and then you can never see what's going on in there again.
Mhm.
And then that cervix is also stenotic, and when she goes to try to labor the next time, that cervix doesn't thin out very easily. So you don't want to overtreat with cryotherapy if you can help it. So if you cryotherapy every single person that has an acetowhite lesion, but that's not actually an HPV acetowhite lesion. It could be a trichomonas acetowhite lesion. Maybe it's not even precancer. And if you cryotherapy every single person that has HPV, but if you gave them 3 months, maybe their immune system would take care of it. So what if we brought them in if they have HPV on their self-test and looked at their cervix, and we only cryotherapied you if you had HPV and an acetowhite lesion?
Well, we tossed that one around, and I didn't actually explain, but you may already know this, Betsy, that we only screen people from 30 to 50 because women would have already then passed defeated the virus themselves presumably by age 30 if it was going to pass. So we're basically screening the most vulnerable population age group in the population. But Yeah, we toss that around. Do we treat these people? And this is getting a little clinical for the rest of the people on the call, but do you treat people that don't have the seat of white changes? Um, it's a conundrum, but I, did my very best to follow the advice of an oncologist in Haiti that was familiar with the situation, and his advice was sort of unequivocally to treat. So we're actually not using cryotherapy. Most of our cryotherapy units got a little clogged up, and I would have to keep bringing them back to Connecticut to get serviced. So that has sort of gone the way of the dinosaur. The thermocoagulation works beautifully. The
I'm so happy to
services
hear
that
you
I've
say
seen
that.
that are
Good
post-treatment.
morning, Thermo, yay! I'm so happy to hear you say that.
Oh, yeah. And the cervixes post-treatment that I see, 6 to 8 months, a year later, are beautiful. We have had no problems. And, and not with cervical problems, during birth, perinatal problems. It's been pretty good, knock on wood.
A question that we just got from the chat is, it seems okay for women to be examined by men. Is that true?
No, that's not really true. We had so little exam hesitancy, if that's what you want to call it, because we're all women. But if there was a guy ever with us, it would not be the same thing, especially if it was a white guy coming from the States with me, a doctor or a medical person. That would not be acceptable. Our doctor, because he's our medical doctor on the ground at CSUG, does do screening. He does do pelvic exams and speculum exams, and he's accepted because people know and respect him. But I don't think that we'd have the willingness that we have with our women if it wasn't a woman to woman thing. Not to get too sort of, exclusive about it, but it does help. And I know in other cultures we've talked about the hesitancy of the women to get examined and to take their clothes off. We don't have that problem, at least in Arrondissement de Balance. I don't know, Jim, in down near La Caille, do you have that problem, or Betsy would? I haven't really heard of that being a Haitian thing. I know in Mexico, Guatemala, some places in Latin America, it's been an issue with indigenous people and sort of a mistrust. But women seem very open to it. As a matter of fact, they push their way through the door. And we charge for, we charge 100 goud for the test, which is about a day's wage these days.
Well, I'll just respond very quickly to your question. We don't have any issue with that. I think maybe partly because all of our clinical staff are Haitian women. And so they're comfortable with who they're visiting with when they come in for consultations. And it is, I think, as you say, it's a cultural thing too. They just don't seem to have a problem with it if somebody's taking care of them, if they're going to get medical care.
Right, thank you.
Any other questions? Well, thank you so much, Louise. I want to thank all of you for coming and all of our guests, and I hope that we will have a chance to see you again at other WIL events. And Louise, in appreciation of your taking the time to speak with us today, WIL is going to send a $250 check to HHP in your honor. So thank you very much.
Thank you so much, and I really appreciate all the support that WIL has given HHP. It really kind of helps us have the will to believe that we can march on. So thank you, and thank you everybody that took the time to tune in and travel with me. I appreciate it.
This has been recorded, except for about the first 3 minutes. I was a little late on the uptake. I apologize, but this will be available on YouTube in a couple of days. So I will send the link to you, Louise, and anybody else can also get the link on our website.
Oh, perfect, perfect.
Thank you all.
I just want to say something to Louise. Louise, it's wonderful to see you again.
Yes, thank you. Yeah.
And that's amazing how far the whole situation that you're doing in Haiti has come since the first time you presented. I
Right,
mean,
I presented to you guys in 2014. That was just we were taking baby steps then.
right. And you've just expanded so beautifully and you're
Thank
doing
you.
so much more. It's just incredible. So
Oh.
congratulations on all that good work.
I appreciate that.
Yeah, great. Thank you, Louise.
Okay.
Thank you. Hope to see you all in May. And again, Louise, thank you very much.
All right. Bless y'all.
Thank you.
Bye.